and those are usually provided. The birth sling, that is similar to a rebozo, and then a massage or oil. And if there's any affirmation cards or photos, those are things that could be used. Okay, so we're going to see another video on some of the relaxation and mindfulness techniques.
Preparing for birth includes learning about comfort techniques that can ease labor pain. Your brain is a powerful tool in managing pain, and these techniques help you focus your energy in a way that is mindful. This can lead to a positive and productive labor. Creating a calm atmosphere helps relax your mind and body. When your muscles are relaxed, pain is reduced. Your body produces fewer stress hormones, and more oxygen flows to your baby. What we see impacts our emotions and behavior. Consider using soft lighting, such as an LED candle, to help you feel warm and tranquil. Music can help you relax and work through your contractions. You may find certain sounds like ocean waves, rain, or chirping birds helps you through contractions. Certain smells have a calming and comforting effect. So if you're planning to give birth in a hospital or birth center, you can ask about bringing an aromatherapy diffuser and some essential oils. Visualization and active imagery are effective tools to use during labor. One way to use visualization in labor is to draw a mental picture of what is going on inside the body. For example, picturing your cervix opening or your baby dropping deeper into your pelvis can help you relax through contractions. Active imagery is a journey your mind takes to a relaxing place, such as a beach, a waterfall, or watching clouds float by. The purpose of active imagery is to reduce tension by concentrating on a place and mood separate from your current situation. For example, imagine that each contraction is an ocean wave. Picture your baby's movement inside of you, while imagining what it will feel like when you hold your baby for the first time. Visualizing yourself in a peaceful place, like a favorite vacation spot, can also be helpful during labor, especially between contractions. Imagine the sounds and sensations of being there.
Turned on like my little audio meditation of just getting in the zone. It helped tremendously. And I feel like it really helped him and me just become one, and he just moved down.
Focusing on a specific object, called a focal point, gives you a sense of control as you move through each contraction. Consider bringing a photo or a meaningful item to focus on. Counting or repeating a positive thought or affirmation can also provide focus. Breathing is another effective technique to reduce pain and discomfort. Breathing helps contractions work better as it brings oxygen to your uterus. It aids your baby's descent because it relaxes your muscles, and it provides a distraction. You can use slow, deep breathing during contractions. Imagine that each inhale brings strength, while each exhale pushes out pain. There's no right way to breathe during labor. If a certain technique or pattern is helping, then it's right for you. Vocalizing low tones with an open mouth, such as sighing or moaning, can also help to release tension during contractions. Avoid making high-pitched sounds because they'll tense your muscles and reduce oxygen flow.
We really did a lot of centering and grounding and just trying to relax. That was going to be the hardest part for me, was really being able to relax.
Okay. We know as well, massage is a really, really good technique to help relax. Who doesn't like a good massage? Some people don't, but for the most part, we know that it relieves tension. It does bring oxygen to the muscles, which is really important during labor. Also, you want to find out what the touch and where the massage feels best, maybe even before you start the labor process, just because some people have more sensitive areas than others. And we just want to know what works best for each body. And to go here again.
Physical comfort measures that provide natural pain relief are very effective during labor and birth. Techniques such as massage, acupressure, and hydrotherapy can prevent the painful stimuli of labor contractions from reaching the brain. Massage is a helpful comfort measure to use during labor. It soothes muscle aches and pains, increases blood flow, and it's relaxing. Start massage early in labor so you get used to the touch before contractions get too strong.
How does massage work to provide comfort during labor?
Massage is a wonderful tool during labor because it sends pleasure signals to your brain, and those signals can actually dull the pain signal, so you get some relief and the pain signal is quieted a little bit. Now imagine you had a really stressful day and you came home sitting on the dining room chair and your loved one comes up behind you and starts massaging your shoulders or maybe playing with your hair. Can you feel yourself just melting in that chair even as I talk about it? Massage is a wonderful tool for labor.
Partners and support people. Practice massages before labor so you can experiment with different pressures and techniques. Keep in mind that sometimes the person in labor is just too sensitive to be massaged, so be flexible.
So in the beginning parts of my labor, my support was giving me a massage on my lower back, and it felt really nice. It was really relieving to, release those muscles and to kind of start to open up. But once my contractions started getting closer together, I was like, you're gonna have to take your hands off of me and nobody come around me. And they were totally okay with that. It's important for your support to acknowledge your needs and how they might change and be okay with them shifting and changing throughout the entire process.
One acupressure method that is used for back pain during labor is the double hip squeeze. To do this, place your hands low on your partner's hip bones and press inward and upward firmly during contractions. Hydrotherapy is a technique that uses water to make you feel more comfortable while in labor. Hydrotherapy is sometimes more beneficial if you wait until active labor before using it. Being immersed in warm water relaxes your muscles and relieves stress on your entire body. If your labor room has a tub, the warm jets provide a soothing massage, especially if you're experiencing back labor. While it's common to feel some back discomfort during labor, back labor is a more intense pain that happens as a result of your baby's head putting pressure on the lower back. If your water is broken, check with your healthcare provider or nurse before using the tub. Another option is getting in the shower. The spray of warm water on your belly or back can also be soothing.
I think the tub helped the most. Something about the tub and the water, like actually relaxed my body a lot. And I couldn't really feel the contractions, like when they were coming in the water. It was crazy, but it helped.
All right. And now we'll talk about a couple other relaxation and mindfulness techniques of the labor environment. We did talk about massage. We'll do a little bit more about some of the vocalization and visualization and focusing, and then some breathing patterns.
Preparing for birth includes learning about comfort techniques that can ease labor pain. Your brain is a powerful tool in managing pain, and these techniques help you focus your energy in a way that is mindful. This can lead to a positive and productive labor. Creating a calm atmosphere helps relax your mind and body. When your muscles are relaxed, pain is reduced. Your body produces fewer stress hormones, and more oxygen flows to your baby. What we see impacts our emotions and behavior. Consider using soft lighting, such as an LED candle, to help you feel warm and tranquil. Music can help you relax and work through your contractions. You may find certain sounds like ocean waves.
Sorry about that. I thought I didn't realize I was duplicating that. So now we'll go into the guided exercise. So we're going to try this. See how you feel when we go through this guided exercise. Just try to, if you don't mind, just try to go along with the guided exercise. Close your eyes, relax. See if it does help. I'm going to do this.
Active imagery is a journey your mind takes to a relaxing and beautiful place, such as a beach, a garden, somewhere you felt secure during childhood, or even somewhere imaginary, such as floating on clouds. The purpose is to reduce tension by concentrating on a place and a mood completely separate from your current situation. Close your eyes once more. As you're breathing in and out slowly, think of your favorite place. Picture yourself in this place. Notice everything about it. What do you see? Your favorite colors surround you. Are there other people in this place with you, or are you alone? Are children playing? Are there any animals, plants, or trees? What types of sounds do they make? Is music playing, or do you hear the soothing sounds of a stream? What does it smell like? Are you floating or walking? If you are walking, what does the ground feel like beneath your feet? As you reach out your hand, what do you feel? What is the temperature? Open your mouth. What do you taste? Begin moving around the place, appreciating every aspect. It is as if everything and everyone is there just for you. You are completely secure and peaceful in this place. You are free. Once you have observed and taken in everything in this place, it is time to leave. You turn to say goodbye, knowing that this place will always be here, knowing you can return whenever you wish. When you are ready, open your eyes and find yourself relaxed in this room, enjoying your peaceful feeling.
So how did that make you feel? I know guided imagery is used a lot in counseling and to help relax people before they do some counseling sessions. So it definitely helps with labor too. And if you can help the laboring person go to that place, just kind of relax them to breathe and get into that mindset, it's very helpful. So I'm going to play a few breathing patterns here for you just to get an idea. You could probably read it in your book, and there might be there's probably examples on the internet, but I'll just play a little bit about these different breathing patterns so you can hear what they sound like.
Start with a deep cleansing breath. Now in fully, out fully, and in, and out fully. In, out. Nice and even. In, out. And a deep breath in, back out. In, and out. In, out. End with a cleansing breath.
Okay. And that slow breathing is used probably, it can be used at all points during labor, but we see that a lot more at the very beginning. But again, it depends on what is helpful for the laboring person. So here's another one called paced breathing.
Start with a deep cleansing breath. Now in fully, out fully. In, out. Now faster. Now slower and fuller. In, out. In, out. End with another deep cleansing breath.
Okay, and then the last one will be patterned breathing. And one thing to remember about these faster paced breathing patterns, we don't want to continue to use them for a long period of time. We want to make sure that the patient's not hyperventilating and that's decreasing oxygen to the baby. But these are just for, they can be done periodically. But also you can see how the big cleansing breath at the beginning and a big breath at the end help rejuvenate that oxygen if they've been doing a fast breathing pattern.
Start with a deep cleansing breath. End with a deep cleansing breath.
Okay. So again, some people may use these, some people may not, but we do know that they typically do help. It's a distraction technique, and sometimes definitely trying to get more oxygen to the baby with a deeper breathing. So these are a couple more discussion questions. What are 2 things that we can do to help our laboring patients cope? And why do you think breathing techniques are important during labor? Just kind of answered that. So So now we're going to look at some labor positions. We're going to look at first stage labor positions and second stage labor positions. And these are things definitely we can help our patients with the positioning and the support people. We can teach them how to do these.
Labor and giving birth are hard work. Changing positions often and letting gravity do the work with upright positions helps to move things along.
Why is it better to move during labor?
It's really important to move during labor because, as you can see, your pelvis is not a stationary bone. And if we try to be in just one position, it limits how the baby can come into the pelvis and make their own rotation to get out. When we move, when we walk, when we squat, when we side lie, the pelvis is in all different positions, and that allows the baby to maneuver through the pelvis and come out. So you have to move your pelvis to allow the baby to get through.
A shawl, known as a rebozo or a fabric belt, can be used to support you in certain positions as you move around during labor. This animation shows how your baby is positioned inside of you. When you use an upright or forward-leaning position like this one, gravity helps your baby rotate and descend. These positions are all good options during labor. Sitting, standing, squatting, hands and knees, lunging, and forward-leaning. If you're more comfortable in bed, try lying on your side instead of your back.
Laying down just was horrible. The positions that helped me, definitely being on the birth block, walking.
You can add calming, rhythmic movement to almost any position you use. Try rocking your pelvis while on your hands and knees, walking instead of just standing. Or slow dancing with your partner or support person.
So during labor, really wanted to get up and get moving to help the baby drop down. We danced to Push It. It was on my my labor playlist. So I got up out of the bed while we were in the hospital, and Shannon, we started dancing. She put her arms around my shoulders, and we were just dancing to Push It.
Yeah, I think what helped the most was doing the squats and, me being behind her and like holding her belly, and we just kind of like doing the squats together. But yeah, eventually we got that baby to come down.
A birth ball helps you get into comfortable and productive labor positions. Sitting on the ball can reduce pain by taking pressure off your perineum, the area between your vagina and anus. Rocking your hips while sitting on the ball can reduce discomfort from contractions and help with your baby's descent into your pelvis. Or lean over the ball and sway from side to side.
If I decide to get an epidural, will I be stuck in bed?
After you receive an epidural, you'll no longer have the strength to be up, walking around and moving around the room. However, in bed, you'll still be able to change positions, both for comfort and to facilitate birth. For example, we can use a peanut ball. After you have an epidural in bed, you lay on your side and the peanut ball can go between your thighs. It helps to keep your hips open and help the baby to descend in your pelvis.
A peanut ball is useful if you've had epidural anesthesia, or you're simply too exhausted to move from the bed. Check to see if your hospital or birth center provides fitness for peanut balls, or ask if you can bring your own. Partners and support people. You can help by learning about these different positions and suggesting them throughout labor. It can be easy for someone in labor to lose focus, feel fatigued, and want to stay in bed. Gently encourage movement and changing positions. Remind them that doing this can help them feel more in control and get the baby into the right position for birth.
We walked around the floor and we had a yoga ball in the room, and sat on the yoga ball and kind of was using different positions. I moved around a lot.
We covered that room from position to position. We just kept moving around, all sorts of things to help with the contractions.
All right. And now we'll look at some second stage labor positions.
While movies and TV shows make it seem like most births happen while lying on your back with your legs in stirrups, childbirth professionals will tell you this is far from true.
What are the benefits to using a variety of pushing positions?
So using a variety of pushing positions will be good for you in labor because that helps the baby to descend into the pelvis as well as takes the pressure off the perineum and kind of helps you from tearing. Sometimes you don't know what works and what feels good to you until you're able to move around and find that space.
When it's time to push, you can try positions that use gravity to your advantage, like squatting, semi-sitting, side lying,
And push.
and hands and knees. You may find it helpful to use a birthing bar or birthing stool if your hospital offers them. Keep in mind that some positions might not be possible if your lower body is still numb from epidural anesthesia. Partners and support people. You might suggest several of these positions over the course of the pushing stage. And keep in mind that pushing can happen in one position and giving birth in another.
Sarah tried so many different positions when she was pushing. It was pretty cool. The midwife, every position, she'd be like, all right, let's try this one next. It was like probably, 5 or 6 different positions we tried.
Pushing. When you get to that part of the labor and delivery process, I think it's kind of one of those things you don't know what it's going to be like until you're actually there. One of the things that I did not anticipate was that I actually didn't like being touched while I was pushing. I really wanted to focus on each contraction and feeling my body working to get the baby out. But I also wanted to take my mind away from pain. So I reached for my partner's hand. Being the lovely man that he is, did not let on how hard I was gripping onto his hand.
She would squeeze so hard. Like when in the movies, when they're like, oh, my hand, it's exactly like that.
You're fine. I pushed the baby out.
Well, you have a variety of positions to choose from for labor and pushing. Follow your instincts. Often, your body will tell you what to do.
One, two.
Okay. Now, in the clinical situation in the hospitals, they are going to be probably a little more limited, but people can ask for different positions. I have seen, as I know Sutter definitely Sutter, not Auburn Faith, but Sutter Davis has the, I think they've got a birthing bath. They probably support some of these other alternative birthing positions a little bit more than maybe say Kaiser does. I don't know about Mercy, but it will somewhat depend on the facility that you're at, what positions they will allow or support for the birth and what providers they use. Midwives are going to support probably more alternative positions than the physicians will. That not all of them, but that's pretty much what we see. So here's a couple more discussion questions. Were there any labor positions that you would be interested in trying with your patient? Why or why not? And that just means, obviously, you will be working in tandem with your nurse, but there might be different positions that you might ask the nurse. Is it possible if the patient wants to try a different position? But yeah, just add a few here if there anything that intrigue you. And then how did you feel throughout the guided exercise when you put your mindset in that? Did that help you relax? What parts do you think were most useful or helpful, if at all? So back labor is a little bit different. This is when the baby, what we call is OP, so occiput posterior. So, or you might hear the term sunny side up. So that's when the cardinal moves do not allow the baby to come out face down, that they come out with face up. So that can create a lot of back labor because the occiput, the baby's head is on the back. So there's different positions that we use to help with that. And tips for long labor. So what we want to see is rest if you can, and change positions as often as possible. Change the atmosphere of the environment. So it's not just stagnant, again, it's just refocusing, changing up the mindset. Stay hydrated and nourished. And if that's something that gives a little bit of glucose, but also maybe some protein, but definitely lots of water if they don't have an IV, and definitely lots and lots of fluids. Most hospitals will start IVs just in case of a complication. They don't want to try to insert an IV in an emergency. So they'll put in a fairly large bore IV just to be able to give a fluid resuscitation, because a lot of fluid can be lost and a lot of blood if there's an emergency. And support people may need a break. So you might want to consider a couple different support people, and always trying new techniques, sometimes just mixing it up again. So, and then what is asynclitism? And how can we support our patients during contractions to help resolve this? And then how can we ensure we provide family-centered care throughout labor? And that changed a lot during COVID. Now we're back to allowing a lot of support people and families in. All right. So we're going to do a little review here.
Natural comfort techniques make labor and pushing more productive. Even if you plan to use pain medication, it's still a good idea to practice some of these techniques.
This slide's going to go up and over here.
Creating a birth preferences plan is a way for you to communicate your wishes for labor and birth. Remember to stay flexible. During labor, it's important to have hands-on support from people you trust. Don't forget, you can also consider working with a doula. Relaxation and other mindfulness techniques can help ease labor pain. During labor, physical comfort techniques like massage, acupressure, and hydrotherapy can help. Using different labor positions helps manage discomfort and move your baby into the birth canal. You may want to try standing, walking, or even slow dancing with your partner or support person. Getting into a forward-leaning position using a ball can also be helpful. If you're more comfortable in bed, try lying on your side instead of your back. When it's time to push, try positions that use gravity to your advantage, like squatting, side lying, and hands and knees. Most importantly, trust your body's natural instincts. Find what works best for you, so you're prepared when it's time to give birth.
All right. So these are the last discussion questions. What were two of your favorite comfort techniques discussed in this module? And just why? Describe one role of the L&D nurse that you did not know before this module, or if you knew of them, a role that maybe you learned a little bit more about. And what can you take away from this module that you can use in your nursing practice on other units, not just L&D? All right. Well, thank you for joining in this childbirth education module, and hopefully you did learn a little bit about this, learn a little bit about the childbirth education, kind of some of the things that